Beautiful. So I'm going to take a moment to just, I guess, talk about myself for a minute. So I'm a sexologist. Basically, that means that I have a background in psychology and then science medicine, and I'm someone that people go to when they have a question or concern or curiosity about sex, or they just want to have a little bit more fun in the bedroom. I tend to see really complex cases, so I deal primarily with like quite heavy trauma cases, and painful sex is probably my bread and butter. It's something that I really do enjoy because I really I like to think of myself as more of a sex detective. So I meet someone, I ask a lot of questions, and I put the pieces of the puzzle together around why they're feeling this way, what their concern is, where it's coming from, for example. And I think when it comes to scleroderma, of course, it's extremely complex. It's not something, there's so much more for me to learn as well on this topic. And I think for all of us, like the research and I think the amount of time that has been put into scleroderma and sexuality and intimacy is quite minimal. Sex is something that we haven't studied a huge amount across many domains. And look, I think that there's so much more that comes from conversation rather than scientific studies with this topic. So, of course, and look, Louise, you can always send me an SMS if there is a question or something like that, because I do have my phone next to me, and I can read it out instead of flipping screens over as well. So I'm going to start. I did actually base this presentation off the new pamphlet that is coming out from your organization, because I thought it's worth kind of expanding on a lot of these dot points a little bit more. And I will need, I guess, your guidance a little bit to see if there's anything that you would like to discuss further. At the end of this presentation, I have got about 15 anonymous questions. I can push my presentation to just past probably about 11:40, so we've got a bit of time, but I'm going to try and get through as much as possible, and then I'm going to go to the anonymous questions as quick as I can, because I think these are the real ones that I want to focus on, because they're coming straight from you. So, of course, you all know what scleroderma is. It is about difficulties with connective tissue, and it can be quite painful. It can affect so many different organs, and it can come in many different forms. All of these can be quite difficult. I also have Raynaud's syndrome, so I know what it feels like to have that pain there. And I know what it feels like to have someone go, oh, you feel a little bit, different, or you feel cold, or not really understanding, I guess, the difficulties that you do go through. I also know what it's like to have very, hot baths at the end of the day to make sure that you actually don't go to bed with too much pain, but sometimes there's just nothing that you can do to really avoid the discomfort. It is also more common in us femmes than it is in masculine people as well. So lucky us. It can start. I think it's actually really hard to get a diagnosis sometimes for this concern, and I think that you can go, visit many different doctors who just say, make sure that you wear gloves or whatever, or go see a rheumatologist. And I feel like it takes quite a long time. I'm not sure what the stats are around that, but of course, I think as femmes, as females, we also get discounted for our pain, and I think for our concerns around our body. I think we look quite tough, and we do know from research that in the medical field, women are not taken, like women's concerns are minimized quite a lot. I see that quite a bit with also my sexual pain patients, especially around endometriosis and gynecological concerns, or vaginismus, which sounds like Christmas of the vagina, but it's the opposite. It's like Halloween. Vaginismus is where there is pain upon penetration. So if this is the vaginal opening, whenever something like a penis or a finger or a tampon, or even with a cervical screening pap smear, a device goes in there, it feels like burning, stinging-like sensations upon penetration, or razor blade-like sensations. This is a common concern that is really underdiagnosed. And, I will see women that have gone for, 10, 15 years with this concern, and I've seen multiple different specialists. And the reason why they haven't got a diagnosis is because in the medical field, there is like a very small amount of time, or like there's like one lecture, like a 1 hour lecture on sexual concerns in the medical degrees. Of course, we have trailblazers, like there's a sexologist called Anita Elias. There's some amazing other sex experts who are really pushing to have more education in this area in the medical degrees in universities, but it is tough. So doctors actually don't know, because they can see maybe that there's no thrush there, there's no skin conditions there, and they go, oh, it looks fine, and you don't have an STI, so I think it's just there's nothing actually wrong. With sex, the biggest sexual organ is the brain. So a lot of the time with sexual concerns, we can see, okay, maybe there's something there, or maybe there's not. You cannot see what's going on in the brain. So sexual concerns need a lot of conversation. They need investigation, and they need to look into the psychology of the person, because if our brain sends signals to certain parts of our body saying this is going to be uncomfortable, this is going to be painful, the body is going to respond, and it's going to tense up. And I'm sure a few people know probably what that feels like, that tension. It might be in your pelvic floor, and that can mean, yes, pain on penetration, or a deeper pain up towards where your period pain is. So on the back wall, it can feel like hitting on the back wall. This is something that I deal with quite regularly, and I work with some great pelvic floor physiotherapists that can help just relax that pelvic floor sling. It's like a hammock that's holding up your bladder and your bowel. On the flip side of that, we will talk about bladder incontinence and bowel incontinence a little bit later in this presentation. But if any of you do feel pain with sex, or have had concerns around pain with sex, that's something that I would like to talk about a little bit later and hear you out. Of course, we've got some risk factors here. I know that a lot of you would be aware of these, and of course, I think when it comes to external factors, the certain stress is a really big one. We are all pretty stressed. It's, I think, especially like this younger generation, I do see a lot of like expectations, high expectations around achievement, and they're pushing themselves very hard. But I also know from, my parents and my grandparents' generations, I come from an immigrant family. I know that, of course, a life stress was also very high. Stress and sex don't really mix. They lead to reduced desire, but also when we are stressed, it's our shoulders and our pelvic floors that are contracting, and that's where we can also get difficulties with sex, and that's also where we can get, difficulties with concerns like scleroderma. Common manifestations, of course, hands, we have arthritis. So yes, I also know that pain with your joints, but of course I am very lucky that I have quite minimal difficulties. We have problems with the gastrointestinal tract as well, which can be extremely painful depending on what time you're getting it, and can cause difficulties with things like oral sex as well, or depending on if you are in sex, if you are having sexual fun, play with someone, and you start to get that pain there, of course you need to stop at that point and reach for medication or something to help. We have difficulties with skin changes, which can make people feel, I guess, self-conscious, but can also cause pain and discomfort. We have lung disease, which can make strenuous activity, sexercise quite difficult, because you are not able to keep up, and you get shortness of breath, which can also be quite scary as well. And there is kidney damage there, which can lead to a whole, a multitude of different concerns as well. When it comes back to this arthritis and limited mobility, that can cause difficulties with things like, of course, hand play, but also like certain, positions. If you're in pain and you're trying to hold yourself up, or you're trying to, be in a certain position. Maybe that's on top, or maybe that's on all fours, or maybe that's just in missionary lying on your back. If you're in pain, it can be very difficult to move around and be mobile. And of course, Raynaud's very painful, very difficult sometimes to be able to have some mobility of your hands. So with scleroderma, if you are in pain constantly, if you are also feeling self-conscious because of the changes that you're experiencing, you can, have difficulties with depression. Of course, fatigue is a major concern as well. And if you're tired, sex is probably the last thing you want to do. You want to just go to bed. You want to have a snooze. And that's okay. I think we really need to talk about, we cannot discount intimacy. So things like snuggling, petting, kissing, these are, it's just stroking, playing with the hair. A head scratch is sometimes better than sex. A massage can also be the same. I think, though, we're taught that sex has to be a certain way. Sex is goal-orientated in terms of the way that we grew up and the way that we learned about it. It's about penis in vagina sex, and that really discounts a huge part of the LGBTQIA+ community and those with different abilities, including disabilities, whether they be visible or invisible, and also people with certain sexual concerns. So that might be erectile dysfunction, that might be Peyronie's disease, which is where the penis does come with quite a large curve, which is something we'll talk about a little bit later. And of course, vaginismus, so that sexual pain concern, or that deeper pain as well. But fatigue is a really massive one. And I think that we should talk a little bit more about how to look outside this goal-orientated, penetration-orientated point of view when it does come to sex, and focus on, okay, well, what can we do rather than what can't we do? And that can mean things like toys, that can mean, planning sexual activity in certain ways, different lubrications, different positions, different locations, different times of the day. And of course, making sure that you go, for this sexual experience, maybe I just want to use a vibrator on myself, or maybe I just want you to pleasure yourself and I be part of that experience. Maybe I can touch you at the same time, or maybe we can just lie next to each other naked and hug each other. These are all beautiful activities and are under the sexual umbrella. So I want you to expand your view of what sex actually means to you. When I ask people, what does sex mean to you? It's always the hardest question for them. They go, oh, I don't know. They've never thought about it before because they've learned from movies, pornography, TV shows that are very, goal-orientated. If you're feeling things like depression, you're not going to feel very sexy, you're not going to feel very good, you're not going to want to have sex. It leads to decreased libido. But of course, a lot of depression medications, SSRIs, can also lead to reduced libido. However, there are medications that do not affect libido that do help with depression. It is worth talking to your specialist, whether that be a psychiatrist or your GP, to ask, is there any medication, any antidepressants that I can go on that are not going to affect my sexuality? And of course, SSRIs can sometimes cause weight gain as well, which can again lead into feelings of lowered self-esteem and sexual self-esteem. Same thing, you can talk to your psychiatrist about this, and there are other options as well. Decreased libido, but fatigue, pain, age, all of these things can lead to difficulties with sexual adjustment. The age factor is something I want to talk about as well. I think that for a lot of people who are of, I guess, an older generation, there comes a stage where doctors and other people say or think, oh, well, she's kind of getting older, or she's gone through menopause, she's probably not having sex. That is absolutely not true. And, when you are older, of course you want to be having sexual activity. It just might look a little bit different to what it was when you were younger, because, you know, you do have difficulties with vaginal dryness, and then also penis owners have difficulties with things like erectile dysfunction, but we'll cover that a little bit later. Range of motion is something that we've spoken about a little bit. So you can do things like, if you are up for certain types of sex, maybe it's oral sex, so someone going down on you, you can always get, we have like, you can get a sex wedge, which is a wedge that you can buy online from a sex store. I will show you what sex store to buy it from after this. It's called lovehoney.com.au. Or you can stick a few big pillows underneath your pelvis to a point where you feel comfortable. Really prop yourself up and get prepared. Same if you are also giving oral sex as well. You know, maybe your partner can sit at the end of the bed, or prop themselves up in a certain way that it feels more comfortable and you're not in a difficult or painful position. You could also just do it in the shower, for example, where you got some hot water so you feel like you're a little bit warmed up as well. But of course, sexual positions can always be a challenge. There are so many mobility aids out there that can help. There's even stools that you can sit on if you want to be on top and in the and sitting on top of like a penis or a dildo, for example. There are little chairs that you can sit on that have like a hole in the middle that can help you bounce up and down. So you're not, you know, putting your hips out because of that amount of movement. So I'm going to show you a few of them a little bit. But I think it's also important to look at a few options to help find the most optimal conditions for those kind of sexual activities. So of course, pain relief is something to look at. Scheduling sexual play for a time when you know your pain is going to be reduced as well. Taking an Epsom salt bath, so getting out those magnesium flakes, really making sure that your muscles are quite relaxed and you're all warmed up to relieve any kind of stiffness. Of course, you don't want to go too hot because you might be a little bit sleepy afterwards or a little bit worn out. Again, using pillows to prop yourself up. And then mouth stretching exercises. So, you know, if you are having difficulties with thickened skin and changes around your mouth, working with your specialist to get good cortisol cream, but also seeing a physio can help. So my pelvic floor physios do also work with different parts of the body as well, to make sure that you're getting a good range of movement around those places where you are getting stiffness or skin changes too. Sex toys are going to be really great for you, and I will show which sex toys that I recommend a little bit later on. I also think if you are experiencing chronic fatigue concerns, working with a psychiatrist on this is a good idea. There are some medications like Zyban, which is also called bupropion, which we use often for chronic fatigue patients. It also helps with depression as well. And I think I think that there are some wonderful options out there. There are also, of course, some great chronic pain faculties in hospitals and programs. But you can always have lazy sex as well. Sex on the side, I think, is also a wonderful idea. So lying down on your side and your partner can be behind you. And either if you're having penetrative sex, you know, using a good lubricant, a silicone or an oil-based lubricant, I probably would go more towards silicone because it doesn't wear out. You're not having to reapply it multiple times. Would be a great option. You cannot use silicone with condoms or with sex toys, so then we would have to switch to water-based lubrication, or, you know, getting a wand. I'm going to see, do I have one here that I can show you? No, I don't. Everything's in my office. I'm going to pretend that this is a wand for you. Hang on, I've got a sex toy here that I'm going to show you. I'm going to pretend this is a wand, and I might go after this presentation and grab a few sex toys to show you. But if you grab a wand and you and your partner's holding it behind you on the clitoral area, that might be a nice thing to do depending on how you feel in that area. Or you can hold it on yourself while your partner's behind you, and they can always, nibble on your ear or kiss your neck. These things are also really great options for you. So, sex is about the new me. So how can I deal with this scenario? And the new we, how can me and my partner or partners deal with this scenario? Talk and communicate with your partner. Talk about when you're feeling energetic. Take an afternoon nap. Really make sure that you're engaging in activities when you're feeling at a good energy level. And remember that orgasm can be like a natural analgesic. It can help reduce pain, but also it has a lot of feel-good endorphins that are released whilst you're having sex and afterwards. Reynard, so of course you have difficulties with fingers. You can get those awful sores on your fingers as well, especially at this time of year. I mean, it's pretty cold at the moment, and it depends also like where you live, what are you doing? How are you taking care of your hands? I know what that pain feels like. It is quite difficult. And it's also a bit annoying because it comes out of nowhere sometimes. And you're like, damn, now I've got all these sores on my fingers. If you do have Raynaud's, of course, using a heater, even just a little floor heater is a good one. I have here that I use. It's just down there on the floor. My dog likes to sit on in front of it usually, but I use it. I keep it on so when I get out of bed, I can put my feet in front of it and my hands to warm up a little bit. Taking a hot bath or shower before sex, making sure that you're all rugged up and you've got those thermals out, gloves. And you know what? You can have sex with your clothes on. You don't have to take off your socks or your clothes. You can just engage in different positions that are going to be comfortable for you whilst keeping you warm as well. And a really fun fact, femmes are more likely to orgasm if they've actually got socks on. There's been a scientific study about it. So make sure that you do keep warm. And of course, these renal problems, so difficulties with kidneys, which can be very painful, and of course, the drugs that are used can have difficulties with cause difficulties with erections, which can be quite distressing. But working with a doctor to look at things like Cialis or Viagra to maintain. To gain and maintain an erection is important. But also, the penis doesn't have to be hard to be able to achieve an orgasm. If you play with a soft penis, it can still have ejaculation and orgasm. But you can also just do activities that have nothing to do with a penis. That can be playing with different parts of the body. That can be making out. That can be oral sex, hand play, toys, etc. And with menstruation stopping as well, this is okay if you're, not planning on starting a family or, having another child. But of course, you can have difficulties when it comes to hormones too, which can cause challenges from an emotional point of view, but also from a physical point of view, which can impact on sex. Let me just have a little sip of my coffee. So what we like to do is look at outer course, so not intercourse, which is something going inside you, whether that be the front door, the back door, wherever. I think it's best to look at outer course options. I actually think that it can be more fun, to be honest. And look, I work with also like a lot of people with who aren't able to have intercourse, and they have very pleasurable, satisfying sex lives because they think outside the box and they look at different toys and different positions to expand on their sexual self. So being creative is also really wonderful. I also love to suggest orgasmic meditation, which is where you can listen to someone putting you in a semi-hypnotic state. It sounds a little bit woo-woo, but it puts you in this state and leads you to try edging, which is where you don't rush to have an orgasm, but you start to build your orgasm by playing with yourself and bringing, or someone else playing with you and bringing up your pleasure, your climax to like an 8. If a 10 is where you orgasm, bring it up to an 8, bring it back down to a 5, bring it back up to an 8, and you start to build this incredible orgasm. And by the time you allow yourself to hit that 10 and fall off the edge into that sexual peak, the orgasm can be a whole body experience. So there is a great orgasmic meditation by a man called Madison James, and you can just find that on YouTube. It's very, very nice. Okay, back to my presentation. I got caught, I went on a tangent, but massage is great, hugging, other types of pleasurable activities, petting, so that's skin on skin, touching, and of course using sex toys, and discussing treatments with your doctor. And if they don't know, we'll find a different doctor. You know, not everyone has the right answer for you. You have to sometimes do a little bit of exploration. And I work with some really wonderful doctors, so if you are in Victoria, you can always reach out and I can recommend you. Vaginal dryness, my goodness, it's such a annoying thing, because we want the vagina to be lubricated if something is going inside it. However, it's not really about the disease or the condition that causes vaginal dryness. It's the medications that are used to treat it. And look, vaginal and genital dryness is incredibly common in the normal population post-menopause. So about 75% of menstruators or women post-menopause do experience vaginal dryness, which is very uncomfortable, but it is common in scleroderma patients as well, which can lead to concerns such as thrush. So what we want to do is, of course, look at different types of treatments with our specialists, use lubricants. I have some patients who use a great lube called Uberlube, and they just use that every day. They pop some down on their genitals, inside their vagina, on their labia, so that they don't get too much discomfort. But also things like coconut oil might work as well. You have to try and test and find what's right for you. I myself even use just coconut oil, especially if I'm feeling like there's some thrush or there is some dryness going on down there. Make sure you use a soap substitute, so nothing with paraffin that's going to dry you out, something like QV, or I always like oatmeal-based soaps and moisturizers such as Aveeno as well, because they're super gentle and really great for you. I think most soaps will dry out any type of skin, to be honest. So we have Aveeno and we have goat soap in our house as well. We want to use a moisturizer down there, but you can also use an internal moisturizer, which comes in a little tube, and you just pop it out, and during the day you will have relief from that vaginal dryness and atrophy. Making sure that it is an acidic-based moisturizer, because the vagina is quite acidic. Usually we go towards alkaline kind of products, but we do want acidic to match the vagina. There is a moisturizer called YesVM, which is quite good. You can talk to your doctor about estrogen-based topical moisturizers or pessaries, which can help. And of course, it really depends on the individual, and if there are any concerns maybe with the BRCA gene, so risk of breast or ovarian cancer, or if there is just, pushback from the body. And again, moving towards non-penetrative sex can also be great. Using bamboo underwear. Bamboo underwear is amazing. Cotton underwear is also good, but I love bamboo because it feels so soft. It's wonderful. And avoiding any perfumes down there. So here we have concerns around the penis. So Peyronie's disease is a concern that we don't hear about that often, to be honest, but you can, if you have a penis, you can wake up one day and your penis can be curved like this, and it is extremely painful. And that's because there has been a build-up of plaque on the inside of the penis here, and it hardens and it distorts and it will curve the penis, which of course will make penetration very difficult, and surgery is needed to fix this concern, but it will always be present, especially that inflammation and discomfort. And there can be difficulties with blood flow as well. Talking to a good urologist is a really great idea for those who are suffering with erectile dysfunction or Peyronie's disease. And sometimes that might mean getting oral medication. So again, Cialis or Viagra. Getting a penile implant might also be an option, and there are injections to help with getting an erection. But if there is difficulties with anxiety and depression or performance anxiety, that's when you can come see someone like myself or see a psychologist, psychiatrist for help as well. Again, alternatives to intercourse are recommended. Difficulties with the gastrointestinal tract. So just pain, difficulties, mouth, stomach, bowels, anus. And if you do want to have oral or anal sex, it can be something that you do need to time, and it might be something that it's not might be, you have to communicate this with your partner. When is the right time for you? What are some measures that you can take to make sure you can engage in these activities, whether that be taking medication for acid reflux or other concerns, or making sure you're not eating heavy foods or anything that's going to cause your stomach or your bowels to have difficulties. Don't engage in anything if you are feeling uncomfortable. And, at the end of the day, sex is messy. There are different fluids, different challenges. So also just be kind to yourself, and, make sure that you have a partner that's also going to be kind and understanding in this circumstance as well. Or give them an education, or come see a sexologist like myself. Make sure that you're washing your sex toys as well. Just warm soap and water is recommended. Okay, so PAH. So the heart has difficulty pumping blood through both the lungs and the body. This can be very distressing and can be, limiting for many people. So that feeling of shortness of breath, that exhaustion, weakness, dizziness, fainting, chest pains, heart palpitations, all super challenging. And working with a good cardiologist is a great idea. But of course, it can make sex very difficult or sometimes impossible, especially because you're pumping, you're doing activities that are going to challenge that area. I think also just looking at blood pressure as well is important. If you do need to work with someone, a specialist like a cardiologist or a vascular surgeon as well, that these are all things that we can consider. I myself have worked with both a cardiologist and a vascular surgeon for these challenges too. And look, I think it can be very difficult. So don't push yourself too much to do anything because you feel like you need to do it. I think it's about making sure that you've relaxed enough, you've taken a break, you've allowed yourself to rest enough that you can engage in these activities. And that's why planning is super important. Finding comfortable positions, seeing if someone else can do most of the work would be a great idea. Using sex toys, and then of course, different aids to help you engage in a healthy sex life without getting that too many challenges as well. But also, just getting a nice erotic massage would be good. Just being naked with your partner is also a wonderful idea and is considered erotic activity. Now, the difficulties with a dry mouth is very interesting. And I think that this can be very challenging because there's not a huge amount you can do to help with this dry mouth, especially when you want to give oral sex. But there are different things like strokers. I'm going to take you, hang on a little trip to my office, which is just next door. And I'm going to grab a few toys now that I think I can show you that might help. If you do want to give like an oral sex-like experience, there are things that are called strokers, which are silicone sleeves that fit over the top of the penis and can help provide some. I'm going to show you 1 second. So I've got a whole range of sex toys down here that I'm going to pull out for you. 1 second. Here we go. Okay, getting a few. Okay. I don't have a stroker, but I'm going to sit here and show you a few things. So I think most of my strokers are at my office, which is okay. But I've got something similar here to show you. So a stroker kind of looks a little bit like this. So it's like a silicone sleeve, and usually they're quite a bit longer. This is the head of a penis pump. I've just pulled it out because it's made of the same material. What you do is you put some lubrication on the inside of it, and then then you slip it on top of a penis. And if I was to have lubrication on here, I would use it, but you slide it up and down the penis, and it does give an oral sex-like sensation. So I'm going to show you where to buy these a little bit later. I think they're wonderful because you can also just go down near the penis if you like, and if you want to give that kind of sensation like you are performing the oral sex, just go down near it. You've already got some lube on there, so it can give a lot more, can help with that dryness a little bit too. I also think there's the opportunity to use things like a wand. This is a massive wand, but there are some mini ones. I just should have been a little bit more prepared. Using this, you can use this on yourself, of course, on the clitoris, anywhere on the body is perfect, on your nipples. But if you are using it with a penis, using it underneath like this while you have some silicone lube on your hands and moving it up and down at the same time will also give a great sensation and is a really wonderful option. So we're talking about different types of lube here. In the pamphlet, it says using water-based lube. I prefer silicone lube because water-based is kind of like spit. It will dry out. Silicone-based lube does not dry out. It's super sticky. Well, not sticky. It's super smooth, actually. It feels very nice. A lot of people use silicone lube even when they're doing things like running so that they don't get chafing on their legs. And they use it, around the vagina or on the penis just to help with that, alleviate any discomfort from dryness as well. Of course, communicating with your partner is super important. If you don't know how to say things verbally, make sure that you write them down or SMS them to your partner. My goodness, time flies when you're having fun. All right, I'm going to be able to extend so that I can answer some more questions, but I'm just going to make sure that I know where I'm up to. Oh, cool. All right, perfect. So early menopause, super difficult. So when I first became a sexologist, my specialty was with people who had bilateral ovarectomy, so both of their ovaries removed for the prevention of breast and ovarian cancer. And of course, that meant early menopause. Same thing here. Oh, give me 1 second. If you have if you have gone through early menopause, this causes all of those difficulties with vaginal dryness, for example, and you know, reduced libido, difficulties with things like depression, anxiety, and you just don't feel like yourself because you're getting all of those hot flashes as well. Also, I think we cannot discount the fact that early menopause does lead to feelings of grief. You know, even if you weren't wanting to have any more children, I think it is still quite a milestone where you cannot have any more children. There's a big difference, right? Again, I'm going to change this. Silicone-based lube is for the best. Pregnancy. So, of course, talking to a good gynae and obstetrician about pregnancy and sex is important, and pregnancy plans are also important. If you are going to go through fertility treatment, then it is something to talk about because it can cause difficulties in terms of timing and I guess urgency, which is more of a mental thing. And I think, you know, trying for a baby is really interesting because it can be like an erotic experience, but if you're going through fertility treatment and you're planning it and, oh, I'm ovulating now, we need to have sex now, that kind of makes it not sexy. So I work with a lot of people who are trying to have babies or have had babies, and then, you know, a baby just interrupts their whole erotic life. And, you know, we really work through different ways of having fun in the bedroom. I'm going to move past this a little bit and talk about my job, which is, I think you've got a little bit of an idea as to, I guess, how I work with people, but it is, of course, asking the right questions, exploring people's sexual needs and goals, talking about sex with them and encouraging them to speak openly about sex with their partner and find creative ways to enjoy intimacy despite any challenges. To summarize, sex and scleroderma can be difficult. You know, fatigue, pain, discomfort, medications, all of these things can lead to struggles with sexuality, but people like myself will work with your healthcare providers to try and find the right answers for you. Thank you. Now, I think we should move on to some of those questions that were sent in anonymously. I would recommend seeing a pelvic floor physio. I think that if you are doing pelvic floor exercises, they need to be prescribed to you and your individual pelvic floor, rather than you going, I don't know what to do. I'm going to get a PeriFit. You're using it, but what if you're, often PeriFits also don't really help because if your pelvic floor is kind of jolting, or if there are other concerns down there, then you can have difficulties. So seeing a pelvic floor physio, not all pelvic floor physios work in the same way and specialize in sexuality. I'm just putting my heater on because I'm getting a bit cold in here. I have pelvic floor physios that work for me that specialize in sexuality and complex cases, and they are available to see patients not just in Melbourne, but nationally. We have a lot of patients that do telehealth, so video calls like this, and internationally. Next question. Okay, scleroderma has changed my body so much, and at times I feel very unattractive and ashamed of my physical appearance. I'm not sure how to overcome this. Great question, and you're definitely not alone here. Even if you know, any kind of change to your body will cause difficulties with sexual self-esteem. I have a great online course called the Sexual Self-Esteem Guide, and what I will do is I will create a discount code for anyone who is part of this group or for scleroderma, this organization, and you can use that. I think that would be a really great course for you to do to try and overcome some of these challenges, because you're beautiful. And look, we're all going to have challenges in life. Scleroderma, of course, is quite a physical, like a visual kind of challenge as well. And I think you have to remember that your body is beautiful. It's just, we are so used to being told that we're meant to be a certain way by media, that it can lead us really doubting our own beauty and our own capacity. Okay. Sex is very painful. Okay. I feel like a virgin every time we're intimate because of this. My husband and I haven't had sex for 2 years. So for me, I read this and I go, yes, maybe it's because the skin is tight, but I actually think it's vaginismus, so the pelvic floor. And for that, I would again recommend seeing one of my pelvic floor physios first. They will then, if you do need to see a sexologist, they will refer you to either, to one of my team members. I'll give the booking code over. You can just book yourself in for an appointment, or email in for an appointment, because no one wants to have painful sex. Of course you're not having sex. It's very hard to want to do something that is difficult. Due to my small mouth, I can no longer have sex with my partner in the same way I enjoyed. Are there aids to assist? I'm a bit embarrassed to go to a sex store. So I'm going to show you lovehoney.com. Hang on. I've misspelled this. 1 second. Here we go. So I'm just bringing up the Australian website. Give me 1 second. I do have a discount code, which I'll send across. So lubes. We want silicone lubes if you're using your hands, but what I'm going to recommend is one of those sleeves. And you need to use a water-based lube with that. One that is very, that can be quite good for you and natural is, I would go for something like this Pure one, or Sliquid Organics, which is really wonderful and very gentle on the skin. I'm just pulling them up so I can share them a bit later. But don't be shocked with anything that you're going to see in here, because of course we are on a sex toy store, but we're going to pull up some penis sleeves. These are all penis extenders. Where is this penis sleeves? Hang on. Sex toys, male sex toys, fleshlights. Okay, we'll go with this. Sorry, we're going to see some things that might be a little bit confronting for some people, but that's okay. I would use something like this to give an oral sex-like sensation. If that's what you're referring to, you can see on the inside it has some nice ridges that feel really good against the penis, and you use it with some great lubricant. But of course, there are also really great sex toys. You can just have a look in here in the male sex toy area. Something like a blowjob toy might be also quite nice as well. There is really a product for everything. So something like this, where it has like different vibrations and suction kind of levels, also feel like giving a blowjob too. So I'm going to pull this one up. Actually, I'm going to pull this one up for a little bit later. There are products for all different budgets as well. Okay, perfect. That's going a little bit slow. So I'll pull out some toys later to help with that. Okay, so again, fatigue, I would recommend talking to your specialist or even a psychiatrist to see if there is a good medication that can help just boost your energy levels a little bit. And then, of course, seeing like a naturopath or acupuncturist will also help. But yeah, fatigue is hard. It's again coming back to what I spoke about in the presentation around managing your fatigue and also managing the time that you do have sex. I'm on my own and have been for a while. I'm avoiding getting close to a man due to leaked bowel and blood. I found very embarrassing. Look, I do know this is a concern. I do see this in a lot of my patients, not just patients with scleroderma. I think at the end of the day, I want you to know that you're very lovable. And of course, while you might be embarrassed about this, there are people that will not be embarrassed about this and who will love you for who you are, no matter what is happening to your body. Seeing a pelvic floor physio is a really good idea. Because they will be able to recommend some exercises to help, and of course maybe a urologist as well to help. Again, yeah, I'll send through the link for my pelvic floor physios, but this is probably one that is a little bit layered, and maybe a counseling session would be good. But don't avoid finding love, because you are very lovable, and you deserve love. And you know, sometimes it might mean just having sexual activity whilst keeping your underwear on, or, you know, doing it in the shower, or, you know, just saying, I've been sick, I've had I've had an accident. At the end of the day, it's out of your control. Tightness. I don't know what area of tightness this is. I think I've kind of covered this. Make sure that you're also using any creams that are prescribed to you, maybe seeing a dermatologist to help if it is on different parts of the body, especially if it's around the mouth. Good cortisone creams, but do not push yourself to a point where you are uncomfortable. We've talked about dryness. We've talked about flexibility. I'm just going to show you, one second. I'm going to show you some sexual aids. I wonder if it comes up if I type it in here. No, that's not what I want. Let me see. LGBTQI. All right. Sexual wellness. Interesting. There's a menopause solution area. Oh, cool. Just different types of lubricants. Wedge. I'm going to pull up some things and I'll send them over a little bit later. I think that's probably better than me Googling it while we're here. But here are some of the wedges that you can use to prop yourself up as well. And, you know, they do come in different kinds of sizes. But I also think just using your pillows is fine as well. I have kind of gone through all of these. This one around scar tissue is a really interesting one. So some gynecologists will work with a laser that will help with that scar tissue. And it's a fairly new laser that is out, which I was actually looking up the other day. It is expensive to use, but I think at the end of the day, you probably need to come see someone like myself who will work with you and a good gynecologist to help with navigating scar tissue to make sure that you're getting an individualized approach. I don't feel comfortable. I don't feel comfortable recommending anything unless I know you. Erections, working with a urologist. This one, I've already spoken about vaginismus. If this is you, please reach out and book a pelvic floor physio session. Okay, I'm finished my presentation and I'm going to wait until we've stopped recording so I can come back over to speak to all of you.